Okay, at the base. This is the prostate gland at the left zone. This is the prostate gland at the testis. The urethra will be here, a little like this. Here it will become like this. It will become like this. In this part of the zone is peripheral zone. This part of the zone is peripheral zone. This part of the zone is peripheral zone. You got the point? Now, when you take in axial cut, the fires will be like here 1, here 2, here 3, here 4, 5, 6, 7, 8. Here see nice tissue will come. 9, 10, 11, 12. Same thing if you imagine here, okay? The prostate will be normally, the base will be here, the urethra will open here, like this. This is what cystoscope you go up, and it will come like this, and it will go like this to membranous urethra. And this is the prostate, and this is the prostate. Only thing is that what you are seeing is on one side, what table behind is on the other side. You got the point? Correct? So, which is anterior? This is anterior. This is posterior. So you are imagining only one side of the surface here. Anterior posterior means rotation. Okay. Diagram, lateral surface, it will be like this only. This is the lateral surface. This is anterior. This is all the peripheral zone. You start from here, go. 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 When you are taking here, significant part is missing, whereas it is significant part is coming. So at the apical region, you will see the more peripheral zone in the axial cuts. At the base and these regions, lateral. Okay, but when you see on the top, this is on the side. You are seeing from the side of one side lateral. Okay, or when you see from the bottom, top or bottom are different. Side is different. This is side. You can't see the urethra here. When you see from the top or bottom, how it will be? The way we have shown. This is very. If you see on the top or from the bottom, the rectum when you put inside, you will see from the back side. Back side, what will be there? This seminal vesicle will be there. It will enter where? Here. See the beak. It will come like this. The same way, seminal vesicle here, it will come like this. This is from the back side when you are seeing. Side, rectum side. So which is the most first structure seen? Seminal vesicle. Next structure seen is the posterior part. Next structure is the anterior part. So in both regions, this part is the peripheral zone. What do you say, Sandhya? Yes. And this part is the transitional zone. Here, where the probe, if you go up, you will target the patient right. For example, if this is a patient right, you will go up, you will target here. 1, 2, 3. Same thing here. Here, here in terms of the lateral, here it's on the right and left. Same. This is lateral surface of only one area, either right or left. Here you are seeing both right and left. So 1, 2, 3, a little lateral, 1, 2, 3. Here medial, then lateral. Here it is anterior posterior. Here it is lateral and medial. Most of it is posterolateral. Most of it is posterolateral. Posterior is this, lateral is this. That imagination. One will be the axial cut. See, this is the base needle axial cut. It will travel. How much yellow it will take? If you really go lateral, lot of yellow will come. I used to do like this.
Up, down.
Extreme up and down lateral. After that, next one will come only this much piece. If you go really lateral, this yellow will come. This is 1, 2. Then this is 3, 4. Then 5, 6, 7, 8. Then apex. Lot of yellow is there. See, 1, 2, 3, 4. This is axial cut. We used to do like this. Put the probe, bend fully, bend fully, bend fully. All are end firing. End means this like this. 1, 2, 3. But probe is like this. You have to tilt like this. 1, 2, 3. Lateral 1, 2, 3. Again 1, 2, 3, 1, 2, 3 like that. Where one is posterior, one is lateral. One posterior, lateral. How many? 1, 2, 3, 1, 2, 3, 6. 1, 2, 3, 1, 2, 3, 6. Sextant biopsy. That is not the correct. So what now we are doing is this is the side firing. It is coming from the side like this, cross. Probe is like this, but it is coming like this. So the anteriorly there is no tissue. So first is this surface first I have shown. Only one side you are seeing. One side you are seeing. One side if you see lateral 1, lateral 2, lateral 3. Posterior lateral, posterior 1, posterior 2, posterior 3. You got the point. But that is not the what we wanted to see. We have to see like this. Seminal vesicles will be here. That area you should not come. 1, 2, 1, 2, then 1, 2, 1, 2, then 1, 2, 1, 2. When you are doing like this, see yellowness has come down. See yellow is less here. Which is more? This yellow is more. So at the apex region, most of it is yellow. This is apex. So if you take like this, it will come more, or it will take like this, it will come more. If you take axial, it will come more. See, entire yellow has come here. Entire yellow has come. Whereas by any means, you cannot, this much yellow only came. You got the point now. So these are all axial. These are all sagittal. In axial, right left is there. In sagittal, right left is there. In axial, posterior posterolateral is there. In sagittal also, posterior posterolateral is there. But who will take anterior? And because your probe cannot do this anterior. You can do it, but it won't come. So end firing, long needle, you take it, see anterior has come. You can never take this part of the banana with this sagittal. So every time, for example, if a lesion is here, you have to go like this. Then that piece will come.